All right, so before I walked into the room, I've washed my hands and I would wash them again as I'm entering the room and introduce myself to the patient. I'm Morgan Mitchell. I'm going to be your nurse practitioner today. This is Sarah Lair. Her birthday is January 2nd, 2002, and she's here for her annual Well Child checkup. First, I'm just noticing Sarah's general posture. It is aligned and upright, and I assessed her gait as she walked into the room. It was smooth and steady, and she didn't seem to be limping or favoring any one side of her leg. I also noticed her speech as we were talking before I began my assessment. She's speaking in her native tongue today, and it was of appropriate content, and she was speaking in a normal pattern as well. As for her vital signs, Sarah's heart rate was 70, her respiratory rate was 18, her temperature was 98.6, her blood pressure was 120/80, and she had 100% on her pulse ox. Sarah, would you rate your pain for me on a scale from 0 to 10?
0.
The patient does not seem to be in any pain today. First, I'm just looking at Sarah's skin. I'm noticing the color is appropriate for her ethnicity. I'm looking at the texture and moisture. Her skin is dry and warm to the touch. I'm looking at her turgor. It is brisk. I'm looking for any bruises, scars, lesions, or nevi, and I'm not seeing any of that. Next, I'm looking at Sarah's nails. I'm looking at their shape, contour, and texture. I don't notice any clubbing or any splinter hemorrhages or any abnormalities there. Next, I'm going to assess Sarah's level of consciousness. Sarah, can you tell me your name?
Sarah.
Can you tell me your date of birth?
January 2nd, 2001.
Yes. And can you tell me where you are today?
I'm in your pediatrician's office.
And can you tell me the situation?
My annual checkup.
Yes, perfect. Just to begin, I'm going to verbalize that her face seems to be symmetrical. And then I am looking at her lymph nodes. I'm going to palpate her pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular lymph nodes, none of which seem to be tender that Sarah noted. Neither of them are warm to the touch or firm or enlarged, which would be signs of infection. Next, I'm going to look at Sarah's hair. I'm looking at the distribution, the color, the texture. I'm looking for any tenderness, any depressions, or any infestations. Sarah, does that seem to be tender anywhere?
Mm-mm.
Okay. Next, I'm moving to Sarah's eyes. First, I'm going to assess the skin around her eyes. It doesn't seem to be dry or red. Neither of her eyes seem to be drooping. They seem to be equal just upon first appearance. Next, I'm going to assess her extraocular motions. Sarah, if you will just follow my finger. Great. All right, her extraocular motions seem to be intact. Now I'm going to use my pen light to assess Sarah's pupils. Both of Sarah's pupils are equal, round, and reactive to light and to accommodation. Next, I'm going to look at Sarah's ears. First, I'm just going to look for any abnormalities like any skin tags. I'm noticing that the pinna is equal with the outer canthus of the eye bilaterally. I'm not noticing any abnormal drainage, no dryness or redness. So I will move on to assess Sarah's tympanic membranes. Okay. Okay. Both of her tympanic membranes were visible. They were both pearly gray. The light reflex was present, and they were both translucent and looked to be very healthy. Next, I'm going to look at her nose with my pen light. Both of her nares are patent. There's no dryness, redness, swelling, or and her mucous membranes are pink and moist. Next, I'm going to assess some cranial nerves. We'll start with cranial nerve 5. Sarah, if you can just clench your jaw for me. And then if you'll close your eyes, I'm just going to touch your face and tell me each time you feel me.
Now. 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 Now.
Great. Cranial nerve 5 seems to be intact. Next, we're going to assess cranial nerve 7. Sarah, can you smile for me? Can you frown? Can you raise your eyebrows? Can you puff your cheeks? Can you pucker your lips? Okay, cranial nerve 7 is intact. Next I'm going to look in Sarah's mouth. First I'm just looking at her lips and teeth. I'm looking at her tongue, her posterior pharynx. I'm looking at her buccal mucosa. Her tonsils seem to be 1+. I'm looking at the floor of her mouth, if you'll raise your tongue for me. Great, and I'm not seeing any abnormalities there. Next I'm going to palpate for TMJ. Sarah, if you'll open and close your mouth. And close, thank you. There's no subluxation, tenderness, or crepitus. And I'm also going to assess cranial nerves 9 and 10. Sarah, if you'll open up your mouth and say, ah.
Ah.
Great. Oh, and a good note. Sarah's soft palate and uvula rise equally with phonation, so cranial nerves 9 and 10 are intact. Cranial nerve 12, Sarah, will you stick out your tongue for me? Can you move it side to side? Great. Cranial nerve 12 is intact. Next, I'm moving on to Sarah's neck. First, I'm just noticing that it's symmetrical. I'm not seeing any lumps or any pulsations just right off the bat. I'm also assessing her skin again. I'm looking at the color, the texture, the temperature is warm. I'm looking for any moisture, any abnormal edema. Her turgor seems to be brisk, and I'm not noticing any lesions, scars, bruises, or nevi in that department. I'm going to palpate her thyroid, which seems to be, or her trachea, sorry, which seems to be midline, and her thyroid. Sarah, can you swallow for me? Great. And next I'm going to palpate both of her carotid arteries. Both of which are 2+ bilaterally, and I'm also going to auscultate for any bruits. I didn't hear any bruits. Next we're going to test your neck range of motion. First, your flexion. Can you bring your chin to your chest? Can you extend just slightly back? And then hyperextension as far back as possible. Great. And then lateral flexion. Can you go side to side? Can you turn it side to side? Great. Or rotate side to side, sorry. So she has full range of motion in her neck. Cranial nerve 11. Sarah, can you shrug your shoulders against my hands? Cranial nerve 11 is intact. Next, for our cardiac assessment, I'm going to listen to all 5 cardiac heart sounds with both the bell and diaphragm of my stethoscope. You'll just breathe normally. Great. Now switching with the bell. I heard normal sinus rhythm, clear S1 and S2 sounds, and no murmurs. Next I'm going to check her radial pulses, both of which are 2+, and her cap refill, which seems to be brisk, and her skin turgor, if you'll turn your hands, also seems to be brisk. Next I'm going to move on to my respiratory assessment. Sarah, if you can just take a deep breath each time you feel my stethoscope. I'm going to listen to all of your front and back lung fields. Great. All of Sarah's lung fields are clear and have good aeration, and she doesn't seem to have any accessory work of breathing. She seems to be breathing easy. Now for abdominal assessment, Sarah, if you'll lie back for me. First, I'm just going to look at the contour, symmetry, at her umbilicus, for any abnormal pulsations in her stomach, and it seems to be symmetrical, no abnormalities in that sense. I'm going to listen to her bowel sounds in all 4 quadrants. She has positive bowel sounds in all 4 quadrants. Next, I'm also going to auscultate over her abdominal aorta. I'm not hearing anything concerning there. Next, I'm going to palpate if I just feel anything funny or if I'm seeing any tenderness. Sarah, if you'll just let me know. Anything tender? Okay, perfect. I'll help you back up. And next, we'll move on to our musculoskeletal assessment. You can hop back up. Sorry.
Almost.
First, we'll start with our hand grips. Sarah, can you squeeze both of my fingers? Great. I'm looking at her upper extremity strength. Can you push against my hands? And can you pull against my hands? Great. And her upper extremities are warm. Looking at her lower extremities, can you push? Can you pull? Great. And while I'm down here, I'm going to check her pedal pulses, both of which are 2+. And she has brisk cap refills in her toes as well. Next, I'm going to assess her spine for scoliosis. If you'll stand up for me and face the window and bend over, please. Her spine is perfectly straight. She does not seem to have any concerning signs of scoliosis. Next, I'm going to check your tandem gait. Can you walk heel toe for me? Great balance. And then can you hop on your right leg for me? Can you hop on your left? Great musculoskeletal skills. That completes our assessment. And then next I would just move to anticipatory guidance. I would ask Sarah or her mom if she has any questions and answer those. For this age group, I would screen for eating disorders, any mood disorders like depression. I would educate Sarah to use her seatbelt always, use her sunscreen always. I would advise her to use protection if she is sexually active to prevent against STIs. And I think that's